Project for Point 1 was a controversial medical study conducted by the United States government, beginning in 1954 to assess the effects of radiation exposure on the residents of the Marshall Islands. It was initiated after the United States conducted the Castle Bravo hydrogen bomb test on March 1, 1954 at Bikini Atoll, the most powerful nuclear test in U.S. history. The blast unexpectedly produced a much larger yield than anticipated, and radioactive fallouts spread over surrounding areas, exposing hundreds of Marshall's people and American servicemen to significant levels of radiation. The residents of the affected atolls were not evacuated until days after the test, during which time they were exposed to radioactive ash. Many suffered acute radiation sickness, including nausea, skin burns, and hair loss in the short term. The study focused on documenting the immediate health effects, but long-term monitoring revealed devastating consequences such as increased rates of cancer, thyroid disorders, birth defects, and other chronic illnesses among the exposed population. Project for Point 1 has been criticized for its lack of informed consent in the exploitation of the Marshall people as unsuspecting subjects. Many islanders were not told the true purpose of the research and were inadequately compensated for their suffering. Critics argue that the study prioritized gathering scientific data over protecting the health and well-being of the affected communities. The societal impact of Project for Point 1 was profound, fueling debates about the ethics of human experimentation and the environmental and human cost of nuclear testing. It also highlighted the systematic exploitation of marginalized population. The legacy of the study continues to affect the Marshall people, who have called for justice, reparations, and further accountability for the harm caused by the U.S. nuclear testing program. Lobotomy, primarily conducted in the mid-20th century, represent one of the most controversial chapters in medical history. The procedure, known as prefrontal lobotomy, involved severing connections in the brain's frontal lobe to treat severe mental illness. It was pioneered by Portuguese neurologist Antonio Manes in the 1930s, for which he won the Nobel Prize in 1949. In the United States, Dr. Walter Freeman popularized the procedure, performing thousands of lobotomies and developing the transorbital or ice-peak lobotomy, which could be performed quickly and without traditional surgery. Initially, lobotomies were seen as a groundbreaking treatment for conditions like schizophrenia, depression, and anxiety, especially in the absence of effective psychiatric medications. However, the procedure often caused devastating consequences. Short-term effects included confusion, disorientation, and personality changes. Long-term effects were far more severe, including cognitive impairments, emotional blunting, loss of motivation, and in many cases permanent disability. Some patients were left in a vegetative state or died as a result of the procedure. Lobotomies were performed on tens of thousands of individuals worldwide, often without their consent. In vulnerable populations such as women, minorities, and children were disproportionately targeted. One of the most infamous cases was that of Rosemary Kennedy, sister of President John F. Kennedy, who was left permanently incapacitated after lobotomy. The societal impact of lobotomy were significant, shaping public perceptions of mental health and raising critical questions about medical ethics. By the 1950s, psychiatric medications rendered the procedure largely obsolete. Today, lobotomies are regarded as a dark period in the history of psychiatry, highlighting the dangers of unchecked medical experimentation and the need for ethical standards in patient care. The Guatemala syphilis experiments conducted between 1946 and 1948 were unethical medical studies sponsored by the United States Public Health Service and led by Dr. John Charles Cutler. The experiments aimed to study the effectiveness of pinyin in treating STI, particularly syphilis. They targeted vulnerable populations in Guatemala, including prisoners, mental health patients, soldiers, and sex workers, many of whom were deliberately infected with syphilis and other diseases without their consent. Researchers intentionally expose subjects to syphilis through the contact with infected individuals or by directly applying the bacteria to their skin or bloodstream. While some participants received pinyin as a treatment, many were left untreated to study the progression of the disease. The experiment resulted in severe physical suffering, long-term health complications, and deaths among the participants. The lack of informed consent and the exploitation of marginalized groups drew parallels to the Tuskegee syphilis study. Experiments were hidden from public knowledge for decades until they were uncovered by historian Susan Reverby in 2010. This revelation caused outrage, and President Barack Obama, as well as Secretary of State Hillary Clinton, issued formal apologies to the Guatemalan government and its people, acknowledging the ethical breaches and the harm inflicted. The short-term effects included physical and psychological suffering for the participants, while the long-term effects extended to families and communities grappling with the aftermath of the experiment. Thalidomide testing, which occurred primarily in the late 1950s and early 1960s, is one of the most disturbing pharmaceutical tragedies in history. Originally developed by a German company in the mid-1950s, thide was marketed as a safe sedative and treatment for morning sickness in pregnant women. The drug was widely distributed in over 40 countries without rigorous safety testing. Shortly after its release, an alarming increase in severe birth defects was observed in children born to mothers who had taken the Lamide during pregnancy. These defects included missing or malformed limbs, organ abnormalities, and other physical deformities. An estimated 10,000 children worldwide were affected, with many dying shortly after birth. Some adults who took thide experienced peripheral nerve damage and other side effects. The tragedy led to long-term consequences for affected families who struggled with the medical, financial, and emotional challenges of caring for children with disabilities. It also highlighted the inadequacies in drug testing and regulation at the time. In the United States, the drug was never widely distributed thanks to the efforts of Dr. Frances Kelso, reviewer at the FDA, who refused its approval due to insufficient safety data. Her actions likely prevented thousands of additional cases. The Thome disaster brought in reforms in drug regulation worldwide, including stricter requirements, clinical trials, and post-market surveillance. It also emphasized the importance of informed consent in medical treatments. Although thide was later repurposed to treat conditions like leprosy, its legacy is overshadowed by the suffering it caused, which continues to influence pharmaceutical ethics and regulation today. The human radiation experiments conducted by the United States government from the 1940s to the 1970s included exposing unsuspecting individuals to radioactive materials to study the effects of radiation on the human body. These experiments were part of Cold War research efforts to understand radiation exposure and its medical applications, as well as to prepare for potential nuclear warfare. Participants included hospital patients, pregnant women, prisoners, military personnel, and vulnerable groups like children and the mentally ill. Most were not informed they were part of such studies. Some were injected with plutonium, uranium, or other radioactive isotopes, while others were exposed to radiation through deliberate environmental contamination or medical procedures. For example, in the Vanderbilt University study during the 1940s, pregnant women were given radioactive iron, unknowingly endangering both themselves and their unborn children. The short-term effects included radiation sickness, burns, and tissue damage, whereas the long-term effects were even more severe with many participants developing cancer, organ failure, genetic mutations, and other chronic illnesses. Some victims died as a direct result of the experiments and the lack of consent, and the harm caused killed outrage once the experiments were revealed. The societal impact was significant, particularly after the experiments were exposed in the mid-1990s, leading to public outcry and government investigations. In 1994, President Bill Clinton established the Advisory Committee on Human Radiation Experiments, which published a detailed report in 1995 documenting these abuses. Compensation was provided to some victims, but many cases remain unresolved. The Aversion Project, conducted in South Africa during the 1970s and 1980s, was a government-backed operation targeting LGBTQ individuals within the South African Defense Force. It aimed to quote-unquote cure homosexuality through chemical castration, electroshock therapy, and forced gender reassignment surgeries. This project operated under the apartheid regime, where discrimination and oppression were institutionalized, and homosexuality was criminalized under the direction of Dr. Aubrey Len. Military, psychiatrists, and medical personnel subjected soldiers suspected of being gay or lesbian to inhumane treatments. Those identified as homosexual were subjected to aversion therapy, which involved pairing same-sex erotic imagery with electroshocks or nausea-inducing drugs in an attempt to suppress their sexual orientation. In severe cases, individuals were coerced into undergoing inverse surgical procedures, including gender reassignment surgeries, often without informed consent. Many victims were left with permanent physical scars, emotional distress, anxiety, depression, PTSD, and an altered sense of identity. The forced surgeries often left individuals sterile and further marginalized them within society. This horrible operation highlighted the extreme lengths to which oppressive regimes would go to enforce heteronormativity and suppress marginalized groups. The project's exposure in the 1990s, after Arth ended, sparked outrage and brought attention to the systematic human rights abuses of the era. The Aversion Project remains a haunting example of medical and psychological abuse justified by prejudice and political ideology. Efforts to seek justice and acknowledgement for the victims continue as part of broader movements for LGBTQ rights and historical accountability. The learned helplessness experiments, conducted in the 1960s by psychologist Martin Seligman and Stephen Meyer, explored the psychological phenomenon of learned helplessness, where individuals developed a sense of powerlessness after repeated exposure to uncontrollable negative events. These experiments were primarily conducted on dogs and aimed to understand the relationship between behavior control and psychological responses. In the initially XP experiments, dogs were placed in a harness and exposed to electric shocks that they could not escape over time, even when provided an opportunity to avoid the shocks by jumping over a barrier. Many of the dogs did not attempt to escape. They had learned that their actions were futile and passively accepted. The discomfort follow-up studies demonstrated similar patterns in humans, where individuals exposed to uncontrollable negative situations often fail to act when later given a chance to improve their circumstances. The short-term effects of the experience experiments on the animals included stress, fear, and physical discomfort. The long-term effects were more significant, as the experiments demonstrated how repeated exposure to inescapable adversity could result in passivity, depression, and an inability to recognize or respond to opportunities for change. The societal impact of the learned helplessness experiments was profound, shaping our understanding of psychological conditions like depression, anxiety, and trauma. It also contributed to the development of cognitive behavioral therapy, which aims to help individuals reframe negative beliefs and regain a sense of control over their lives. However, the Experiments have been criticized for their ethical implications as they inflicted significant distress on the animals. Despite these criticisms, the concept of learned helplessness remains a cornerstone in psychological science, influencing both research and therapeutic practices. The past is full of secrets, and there is so much more to explore. Subscribe now to Spectral History and join me in unraveling the mysteries of history.